Hey, welcome back, Faithful Politics listeners and viewers. If you're watching on our YouTube channel, I am your political host, Will Wright, and your faithful host, Josh Bertram, unfortunately can't be here due to some technical difficulties, but we're continuing our series during Pride Month, and today we have with us Dr. An Pham, who is an adolescent medicine specialist who's trained at some of the top children's hospitals across the country. She's published numerous articles spanning topics like the impact of news on transgender and gender nonconforming youth, disordered eating among transgendered youth, and fertility for gender diverse youth. Dr. Pham also joined the adolescent medicine team at Children's Hospital of Richmond at VCU in 2021. She's an expert, compassionate physician with a special focus on LGBTQ plus care, and her practice includes primary care services, gender affirming care, reproductive health care, and the treatment of STIs. So welcome, Dr. Pham.
Thank you. That was a lovely introduction. Thank you so much for having me.
you're very welcome. And so we're having you on to discuss gender affirming care. But first I want to give a quick shout out to the Children's Hospital of Richmond. So my oldest son actually gets care there
nice.
for a situation he's got in, and I got to tell you, those people are amazing.
Oh, yeah. Well, it's very nice to hear. You know what? We're a children's hospital. So we're very, children's hospitals in general are very different beasts than, your, adult. I'm sure you probably see a vast difference. Mm-hmm. So I'm glad you're enjoying the care there.
Yeah. So I get most of my care at the VA. So comparing VA care to, children's hospital, it's I don't know, getting prison medical treatment versus I don't know. Anyways, so so to start us off with, so you work in gender affirming care. How does one get into that field of study, and or why did you decide to kind of make this sort of a focus area for you?
Yeah, so for me, I love working with teenagers, and teenagers are already kind of a patient population that a lot of people avoid. Just, they have their feelings. And, within the adolescent population, I just found that one of the most marginalized and underserved and underrepresented patient population are transgender and gender nonconforming youth. And I became interested in it, and then once I started seeing patients, it just felt amazing. If you meet trans youth, they're just so fun to work with, but just have so many things going against them, and so I just fell in love with it. I fell in love with the patient population. They're a great group of people.
That's really cool. And how long have you kind of been working sort of in, within this particular sector of people? Yeah,
so about 5 years.
Okay.
I've been doing this.
Got it. And I'm pretty sure working kind of in this field, there's no drama or anything associated with it, right? I'm being sarcastic.
Yeah. I was going to say it's kind of perspective. There's always drama working with adolescent patients, of course. But yeah, it is unfortunately a contentious topic. And even when I tell people outside, on a personal level, what I do, oftentimes people take a beat because they're not sure if they want to ask me about it because unfortunately it is a controversial topic. So it is interesting practicing in this field.
Yeah. And it's one of the reasons that we actually wanted to have you on the show because, we want to be able to ask you kind of all the questions that maybe people may be thinking about when they think about gender affirming care. I mean, I think there's a lot of misconceptions about it. And I'm really looking forward to just having you educate me and our audience about a lot of the different stuff out there. So I guess what's the process needed, to have a doctor consider performing gender affirming care? What's the trigger, or how does that process start?
That's a really good question. And it totally varies, and I have a skewed perspective because I only see, patients in the medical kind of, sphere, but there's obviously youth at school and things like that who don't ever see a physician. So I do see kind of a skewed population, but It really varies. We see patients who are like 8 years old and they told their parents, I don't feel like I'm a boy, I'm a girl. And so the parents really want to know what are their options for their child, so they'll come to see me. Or there's also adolescents who are like 19 years old who have depression and anxiety, and they've been to the ER multiple times because of self-harm, and then finally somebody asks, what is your gender identity? And that opens up the conversation. So it really varies how people come to see me. But in general, we see really anybody whose gender identity is different from their sex assigned at birth. And even though we provide medicines, it doesn't mean that all of our patients go on medicines. We're really just there to provide information and help families figure out what they want to do and what they want to pursue.
Got it. So if I'm understanding you correctly, that the point in which somebody would want to receive care may vary and or fluctuate kind of depending on the person. But like, is there like a normal distribution of, in a child's life where you see like, the most type of people coming to you?
Yes. So you're totally right. There is a very wide spectrum in terms of when people come to us in terms of age, in relation to when they have socially transitioned, which means like changing their names, pronouns, how they dress. Sometimes people will come to see us before they've done that. Sometimes they'll come to see us afterwards. But in general, oftentimes there is a pattern, and that's during adolescence, specifically during puberty. Because for a lot of youth, once they start growing like breast or chest tissue or their voice changes, it's like a concrete, not a reminder, but a concrete way of them realizing, oh, I'm definitely in a body that I don't want to be in. Because before puberty, before those changes, there's maybe not as much dysphoria or distress. So oftentimes we do see more individuals around that time of puberty or after puberty.
That's interesting. And I can't help but wonder, probably something that a lot of people wonder, and that's like, is this like a new phenomenon? Or, or is the need for gender affirming care really the same as it always been? It's just that now it's kind of more public. Like, what are your thoughts?
That is a really great question. So a lot of people, especially because of legislation that's coming out that's targeting trans youth, a lot of people think that gender affirming care, social affirmation, different gender identities that are not binaries, like non-binary, like this is all new, but it's actually not. And we have been providing this care, so I've been doing this for 5 years, but people have been providing this care for many, 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 many years. And it's just that there's a lot of attention on it because of legislation that's coming out, but also there's much more representation. There's now, you see non-binary trans people in the media and also in like political spheres as well, like in Virginia. And so, it's now people are saying like, oh, okay, when you're like a young person, you don't understand what feelings you have, and then you see somebody and you're like, oh, maybe I should Google this. And then you kind of see all the blogs and you're like, oh, this is what I'm feeling. And so I think also trans youth have been there, but we are seeing more people because of improved access to care, but also more, visual representation of gender diverse people out there. So I think there's just a lot, it's a culmination of a lot of things. But that was a very long-winded answer to yes, people have been here for all of time. There have been trans individuals.
That's really interesting. I mean, just because sort of like the sphere of, I don't know, like friends that I have, I mean, I don't have like very many trans friends, more gay, lesbian, but so like, the more I hear about trans stuff, like it's easy for me just to kind of think like, what the heck, like what's going on? Is there an explanation for it? And this is probably going to be a really bad example. Like I think of it sort of like CRT, like CRT's been around forever, like we hear a lot about it now because it's sort of like the popular thing to talk about, but it's been around. And you said that, so you've been here, or you've been in this field for 5 years. Do you happen to have any sort of like historical knowledge about, maybe like the evolution of sort of gender affirming care kind of through the ages?
I am definitely not an expert on that, but I will say that, it was originally a lot of individuals doing this care, especially in the pediatrics world. A lot of individuals doing this care. But, and that was, to meet like the patient population and, people just saying like, oh, okay, there's a need to do this. Like, so on a local level, I need to provide this care. But, the number of like multidisciplinary large clinics are really growing because when individual physicians were treating youth, they were saying there's actually a lot of extra needs that need to happen. Like, for example, mental health. There's so much stigma against youth. And of course, that stigma and internalized transphobia is going to cause depression and anxiety and self-harm. And so, the care that we have provided has really grown into something that's much more comprehensive to meet the needs of youth. But this medicine, the medications that we've been providing, have been going on for a lot of time. If anything, I think just the evolution of it it's getting better. And that's why it's interesting to see that there's so much legislation against gender affirming care, and that it's like people seem to think that like these families are making choices like willy-nilly, but actually the care that we're providing is much more comprehensive.
So I guess like walk me through, kind of what gender affirming care kind of includes. I mean, most people kind of think, okay, maybe it's hormone treatment or puberty blockers. And I'd like to maybe just, unpack some of that later. But like, if I'm a person, I walk into your office, I tell you that, I feel like I'm in the wrong body. Like, where's the conversation kind of go after that?
Yeah, so that's also a really good question because I think people have a really different view of what we do. Oftentimes the very first visits are really just talking to families about different options and the risks and benefits. So a lot of people think that we are ready to inject all of our patients with testosterone and put estrogen pills in people's mouths. But we're just here to just tell people the risks and benefits and families decide what they want to do. Like there are many individuals who don't want to go on hormones for different reasons, and so there's many different options in terms of how to affirm somebody. And to be honest, a lot of our clinic visits a lot of the conversations are about the non-medical things. Like, how is school going? Are you getting bullied? Like, how can we protect you at school? Do you have a bathroom that you feel safe using at school? And so, yes, medical options are really important, but as physicians and medical providers, we also spend a lot of time doing non-medical support for our youth. But yes, we do provide options like puberty blockers, hormones, later on if they're interested in different types of surgeries, but that's really later on. Because it's really rare to have surgery less than 18 years old.
Got it. Yeah, because I've heard the argument like kids should not be allowed to start hormone treatments due to like their maturity level and decision making, and their decisions are irreversible. So what are your thoughts about this?
Yeah, so this is where I think a lot of people have incorrect kind of views on what we do. So I always tell my patients that it's very different for a 14-year-old who's interested in hormones versus a 30-year-old who goes to an adult provider who's interested in hormones. So one of our biggest goals is, again, that we want to do things in a really safe way. And for example, I tell if it was a 14-year-old patient who's transmasculine, if you look around you, the 14-year-olds in your class don't have full-on beards and a deep voice, and so we wouldn't want that for you either. So how we do gender-affirming care in pediatrics is we go low and very slow because, again, we want to meet their age range. And what that means is actually most of the changes are not irreversible. They're actually reversible. And it's not irreversible until they're at higher doses, which you're generally getting at an older age or with longer amounts of time on treatment. And so I think it's really important for people to know that a person doesn't change overnight. It actually takes months for changes to happen, and they're actually reversible. Puberty blockers are 100% reversible. Hormones, depending on the dose and the age, a lot of it is reversible. And then surgeries, we don't do, those are obviously irreversible, but we don't do those in less than 18 except for top surgery, transmasculine, which I can go into details. But again, very, very small percentage of people are having irreversible surgeries before the age of 18.
And what are some of the like, what are some of the reasons or contributing factors from medical scientific standpoint where somebody might actually not feel like they are, in the right body? And again, I'm probably going to use a ton of really bad examples. So like I joke with a lot of my friends because my mom is Vietnamese. She was born in Saigon. My dad is black. When I do my like DNA test, it shows that I'm more Asian than I'm black. So I like to tell people, like, I identify with my Asian heritage because, like, genetically I'm more Asian, but like what you see is, sort of my skin color, and you just naturally assume I'm, African, whatever. So like, what's sort of causing, people to kind of feel like they're in the wrong body?
So that we don't know that, it's interesting because you are asking a lot of questions that actually parents ask for very understandable reasons, right? And so these are really good questions. And parents ask me these really good questions. And I also emphasize this because a lot of people think that families are just making decisions like that. But there's very, really, like, drawn out conversations that parents have with themselves and their child to figure out what are the next steps. And that is a great question. So, there isn't like an MRI scan or a blood test that says, like, oh, your child is definitely trans. What we can tell you is we know that they're sex assigned at birth. So their sex assigned at birth is generally based off of, like, genitalia. Like, if you have a penis, you're a boy. You're assigned male at birth. If you don't have a penis, if you have a vulva, you're assigned female at birth. So we know somebody's sex assigned at birth. And then we know that they're trans because their child is telling you, I'm not a boy, I'm actually a girl. And there's a lot of weight to that, right? Because especially in a world where there's so much stigma against trans people, to have that, to feel that, and to feel comfortable enough telling people that, knowing that there's so much stigma against you, for me, that's enough to say, okay, there's something going on. Let's support them in whatever way we can in this moment to keep them safe.
That's really great. Yeah, when I was in college, I took this psychology class, and I think it was psychology. No, it was like a sex education class, we did this case study where, like, this baby boy was getting, like, circumcised. The doctor screwed it up. The parents said, I don't want my child to have, like, a deformed penis. So they, like, did I'm not going to get the science right, but they turned the boy into a girl. And then the boy just grew up kind of as a girl, then when they kind of reached, like, puberty and these other, like, and the parents never told the child. So, like, like, bad parenting, obviously. but this child basically, like, grew up thinking they were a girl, and then when they hit puberty, they kind of figured it out. I'm curious if that ever happens, like, based on your experience, like, is it like a nature nurture thing? Like if you are a child of trans parents, or if you are a child of, like a same-sex couple, like, does the likelihood of you, wanting to become trans increase?
Yeah, so that's also a good question. So, we don't have that kind of research to know that. But, we do know, like, in terms of research, and because I think what maybe you're getting at is if somebody, for example, were to come to my clinic and say, I'm transmasculine or I'm non-binary, in 5 years from now, is it possible that they could change that gender identity and maybe people could say, like, revert back to the gender identity of their sex assigned at birth? Is that kind of along the question you're asking?
Yeah.
Yeah, and it's so funny because you're asking a lot of the questions that parents ask me when kind of thinking through what they want to do for their child. And so, we don't see that often. It is possible. And I tell families it's always possible that your child may change their mind in terms of what their gender identity is, or because of different factors, trauma, things like that. There is always that possibility. But in general, we don't see that much. And that's why, in general, people who start hormones are on it for the rest of their life. There's a small percentage who are not on it for the rest of their life, and that's people who are, like, non-binary, and they get enough of the irreversible changes that they want, and they come off. But their gender identity hasn't changed. It's just they're not on hormones for the rest of their life. you know, I tell people it is possible, but we still want to think about, so that you still want to think about the risks and benefits of your child could be that small percentage where they change their mind, but also there's risks of not doing something at the same time, and like safety risks. Does that make sense?
It does, yeah. So is there a difference between like gender and sex?
Yes. So sex assigned at birth is what most of us think about. It's like whether you have a penis, okay, so you must be a boy. Whether you don't have a penis, you have a vulva, you must be a girl. So there's sex assigned at birth, and that is basically, for the most part, fixed. And then there's gender identity, which is different. That's who you identify as. That is the gender that is to you. And for most of us, and that's why we make this assumption, for most of us, our sex assigned at birth is the same as our gender identity. Right? Because most of us is cisgender. So we make that assumption. When we see that ultrasound and we see that fetus has a penis, we're already making assumptions. Like, okay, that kid's going to like sports. They're going to be a boy, you know? And so we automatically make those assumptions. But not everybody's gender identity is the same as their sex assigned at birth. And to make it maybe a little bit more confusing, it's not the same as sexuality. A lot of people think that because you're trans, that must mean you're gay. Like, these are all like separate parts of a person's identity.
Interesting. I never really thought of it that way. So it's like sex is the, I don't know, like the objective, scientific, visual like thing that you are, and gender, is it like your state of mind?
Yeah, basically.
Okay.
And it's really interesting too, because we know that actually gender identity can form as young as 2. Like, and not to say that like we should be asking all 2-year-olds like, what's your gender identity? But because around 2, 3, that's when you start having preferences for toys and things that you like. And so, yeah, gender identity is like a totally separate entity than your sex assigned at birth.
Yeah, because it's so weird. So like my oldest, when he was born, I mean, we homeschool, and so he spends a lot of time with his mother, and I would come home from work often, and like he's got like fingernail polish on, and he's acting like his mom, and I wouldn't get afraid or be weird about it. I'm just like, I'm sure if the roles were reversed, he would probably be like me. Like none of us are sports like fanatics in the family, so I'd be really surprised as a boy if he did like sports, but but it just seems like you're just going to naturally pick up sort of the characteristics, and the personality of the people that you're closer to. That was kind of like my earlier question about, if you've got like 2 same-sex parents, like if you're more prone to be gay than not. And, it's not really that big of an issue. But what I do want to ask you though, I'm trying not to necessarily weave any sort of politics in our conversation, but I will at least just talk about one particular situation and then kind of get sort of the scientific answer. So recently there was a confirmation hearing for a new Supreme Court justice. There was a question that was asked in the confirmation hearing where the person was asked like, what's a woman?
Yeah, I know exactly.
I'm curious, like so I'm asking you, like if you were in that position. Actually, maybe that's probably wrong because that's a wrong setting. Let me just ask you, like, what is a woman in your opinion?
See, that's so interesting to me, because if you were asking me what does it mean to be assigned female at birth, which I think is kind of what that person was asking, that's like, okay, based off of your chromosomes, based off of your external genitalia, that is female. For me, a woman is whatever somebody tells me. You know what I mean? It's like, and because what I think is also interesting is my definition of a woman is going to be different from your definition of a woman. And how feminine somebody is going to be different from that person's definition of femininity. And so it's to me, I just respect the person. And I also think like to label somebody, it to me doesn't matter as much as long as we're respecting that person. You know what I mean? Like if that person says they're a woman, okay. I don't know. It doesn't harm me personally.
Got it.
Their visualization or their kind of definition of a woman is different from mine. I just feel like,
because it is like, I mean, so the confusing part for me is just I remember going to school high school, whenever, they say, okay, XX female, XY male, but then I go to college and they're like, well, actually it's not that simple. They're like,
Exactly.
there's there's other combinations of chromosomes that, might, skew what you consider female, what you consider male. So like, can you talk a little bit more about that,
you're going back to, again, sex assigned at birth. And so you're right, even within sex assigned at birth, it's not black or white, because you can have different chromosomes. So the example that you were giving before about the person who had the penis, so that is probably somebody who is intersex. So there's like also a spectrum in terms of sex assigned at birth, where there are people who are not chromosomally exactly, not all people are exactly XX or XY. So XX assigned people with XY, because the beauty of this world and diversity is there's actually also diversity in sex assigned at birth, where you can have one X and nothing. You can have XXY. So there's actually diversity in sex assigned at birth, just like there's diversity among gender identities.
Oh, interesting.
It's very complicated.
Like how many different genders, I guess, are there?
So it's like infinite. So there is so many, and that makes me happy. I know that probably makes a lot of people frustrated to hear that answer, but and probably would roll their eyes. But there's just an infinite amount of gender identities, which is, I think, good, because it's not fair to put people in boxes like you have to be a male or transmasculine, or you have to be a female or transfeminine. For many people, that's just not a label that feels right for them. And so there really is, like, even I tell myself, and trainees, like medical trainees with me, like, you have to have a sense of humility. Like, even if I were to do this for 100 years, there's no way for me to know all the gender identities. And also, again, because there's so much diversity, for one person being transmasculine may have a different definition as another person who's transmasculine or non-binary. You know what I mean? Like, it's just, there's so much diversity.
Like when you say transmasculine, is that a person that was assigned female at birth that like is on hormones or something? I just want to make sure. So not
necessarily. It's a person who's assigned female at birth and who has a gender identity that's more masculine. So that may mean that they use he, him pronouns. That may mean that he's on hormones. He might not be. But for that person, they're assigned female at birth, and they just feel more masculine.
Got it. And then so not all trans people actually like have surgery. Like, I think if
actually a majority of people do not.
Right.
It's expensive, it's invasive, and it's for some people just not a part of their process. Just like not all trans people are on hormones, not all people pursue surgery.
Got it. So you mentioned it's expensive. Like, what's what are the, I don't know, average cost? That's probably not a real easy way to pose a question, but
in general, insurance will cover, for example, like puberty blockers and hormones. They'll generally cover it. Oftentimes, they will not. I've used this word a bajillion times, so I apologize. But there's also diversity insurance. So, for example, there are religious insurances that will deny and will not include any trans care. And so people have to pay out of pocket. But in general, like, for example, Medicaid does cover a lot of the costs. And surgeries, too, they will cover the costs. But oftentimes they get a denial, and then that's where I step in and I say, actually, the research shows that there's medical benefits, physical and emotionally, to surgeries or hormones, whatever the denial is. And we just keep going at it and advocate for the person until insurance will cover at least part of it.
Wow. No, that's interesting. So if you're a parent, what's the best way to kind of navigate conversations, about gender, sexuality with your children? And, what are the, I don't want to say warning signs, but like, what are the things we should be looking at, within our children to determine, maybe if we should even initiate that conversation?
I would just say to be open-minded and be willing to listen and not make assumptions. I think that's the biggest thing, is not make assumptions. Just because your child wants to try on high heels or lipsticks or wants to cut their hair short depending on their sex assigned at birth, it doesn't mean that they're trans, So I don't want people to go like in the opposite direction and be like, oh, everybody's trans. That's just like not conforming to gender expectations, And but if your child does say something that, you know, is saying something along the lines of, I have different feelings inside of me, or I'm more direct, like I'm not a boy, I'm actually a girl, to maybe just listen and be open-minded. And I also tell parents that if your child is sharing those emotions with you, to be very thankful, you know, because that means that they have a comfort level to talk to them about it. Because, again, I cannot kind of emphasize how much stigma there is, and for a lot of you that who probably don't want to tell anybody because it's scary to be a trans person in this world right now, the fact that they're even giving you any information is really amazing and a testament to the parent that they're being open. But I would just say be open-minded, and again, to not assume that you know their gender identity because of their sex assigned at birth, and to try not to push them into boxes. Like, you know, there are girls that like sports too. There are, you know, there are boys that like ballet, you know. And so I think, you know, there's a lot of different pieces of advice that are like rolled up into that answer. But I think just being open-minded and not having assumptions.
Yeah, no, that's great. Like now, what about like the science or the innovations? Like, have there been significant improvements with like the medical care or treatment for transgender people?
I think that in general, there's just more access to research now, and it's never going to be like the research, like the best research out there, because it's really hard to do research on this. But we have more kind of evidence that shows, you know, the importance of not only medical affirmation, but social affirmation. So, for example, we know the research that's out there that says that if you just use a person's correct name and pronouns, their depression and risk of suicide decreases. So just like, and they've looked at like 3 different spaces, at school, in the medical space, and at home. So we know the benefits of respecting somebody by, you know, respecting their social affirmation, but we also know the mental health outcomes of medical options as well.
Oh, interesting. Oh, so you were talking about research, and you've done quite a bit of writing on sort of transgender issues. So specifically, like you wrote, how are transgender and gender nonconforming youth affected by the news? Like, what did you find? What did you find out there?
Yeah, it's a really good paper, and it's you know, it was written during. I'm also trying to keep politics out this,
Sure.
But we did this research project during the last administration, and we basically just asked youth if they were consuming news that were related to trans individuals and how was that impacting them. You know, because I think it's really easy as adults to think that like trans youth maybe don't know about legislation that's out there because they're not on CNN or Fox like, you know, adults are. But we also thought, but maybe they are accessing it because what they have, but we didn't have, is Facebook, social media that makes you know, news much more consumable as opposed to like having to look at the newspaper or like turn it on TV. And it showed that youth are definitely they definitely saw the potential, like excluding trans people from the military, like not allowing them to use the correct bathroom. And so not only were they actively, yes, they were seeing the news, but B, it was definitely contributing to mental health outcomes. And what was also interesting is during the last administration, there were a lot of youth that felt pressure to actually start hormones sooner because they were worried that under the last administration, because they would take away those access, that now they felt like they actually had to transition faster than they normally would. So it actually was pushing people as opposed to giving them space and letting them do it on their own. So it was a lot of really sad findings, but there were some positive things. You know, a lot of people talked about an improvement of their mental health because they saw better representation in the news, and people talked about Danica Rome in Virginia, and this was done in Seattle, Washington. So people knew Danica Rome's name, you know, like a young, they're definitely less than 18 years old. And so there was also positive things about the news and seeing themselves, especially if you don't have any other trans friends. So it was a really good research.
Wow, that's really, because there was an article in the New York Times recently. Actually, it was a podcast. The New York Times has a podcast called The Daily, and they were talking about.
I listened to it. Yep.
And it was really like, I mean, it was basically they were just talking to this family and this trans youth that is concerned about losing access to their care at I think it's called Genesis. I can't remember. It's in Texas. So like what, like if more legislation like that were to come about in, you know, some of the states you may expect that it would come out in, I mean, it's not like someone that's receiving trans care, gender affirming care can just pick up and move to another state, you know? So like, what are the consequences of that?
Oh, the risks, we know the risks because we see in research and we see it in real time. You know, the risk is that the mental health of youth are going to plummet. And that's really the biggest thing about this is we all just care about the safety of our patients. And the biggest safety risk is that they're going to complete suicide, which we know the research out there. The risk of suicide in trans youth is significantly high because of the stigma that's there. And we also know the protective factors. The protective factors are having supportive parents and having supportive people around you. And so, you know, just anecdotally, when those news stories came out, I would personally see patients who were increasing their thoughts of self-harm because they saw that. Because they know that people are targeting them, and that's just a terrible feeling to have. And that's what we're all worried about. And if you ask like any physician that works in the emergency department, they'll tell you a large percentage of people they see are trans. And we actually do have evidence that show that there was an uptick in basically the phone calls that were made to a crisis line that's specifically for trans youth. There was an uptick in the last administration. And so, you know, I just think that people just need to hear, like I loved that daily episode, people just need to hear more from the voices of trans youth. I think people just have really a misconception of youth, and I tell people all the time, if you came to my clinic and you saw my patients on hormones and puberty blockers or nothing because they don't want anything, they're like thriving and doing great because they have the support of people. Like they're in their school plays, they're doing well in school. It's just we as like adults need to be here to support them. You know, like that's all I want for my patients.
I know it's like I think the thing that stood out the most to me as a parent was this mother was just like I just want to make sure my kid is okay, you know, like, and I will do whatever it takes, you know, to make sure that they're fine. You know, if my child tells me that they're sick, I'm going to take them to the doctor. You know, if my child like gets a cut, I'm going to give them a Band-Aid, you know, and like, so this is no different than, you know, just a parent wanting to do what's right for their kids, in my opinion.
Right. Totally.
But, so let's see. So what tips do you have to kind of help families, you know, support children who are kind of navigating these gender issues? I think you touched a little bit on it earlier, but I'd love for you just to kind of you know, give us your sales pitch. Yeah.
The biggest thing is really just to be open and honest with your child and listen to them, and again thank them for being open to talk about it. But my other biggest thing is really find your allies. It is a really scary time to be a trans person and a loved one of a trans person right now. I mean, especially in certain states like Texas. And, you know, you really want to find your allies, find other families that you can talk to who have, you know, kids or family members who are trans. Because I think community is such an important part. And I think it's easy if you look at the news to think that there's so much going against you, but I promise there are people in your corner. And so surround yourself with people in your corner.
That's really good.
That would be my advice.
And so you work at the Children's Hospital of Richmond. So just to kind of give you an opportunity to plug, you know, your facility, like what services are available for gender affirming care at your hospital?
Yeah, our services are really meeting the family where they're at. You know, if, like I said, we don't push hormones, we don't push puberty blockers, we're here to just tell you the options. But again, like I talked about before, we're also here to just provide support, you know, like, again, making sure your family is safe and, you know, the bathroom that you want to use, the sports team, all of those types of things that if you want to talk about, we're here just as a form of support. And so that's why I can't even pinpoint a specific service. We're here to, you know, just hear your story and just meet you where you're at. We just want all of you to thrive and be healthy. and happy.
Is what I meant to ask earlier was like, is gender affirming care something that's pretty common at most children's hospitals?
It's becoming much more common. Yes, it is becoming much, much, much more common. And and one of the reasons why is because every medical body in the United States recommends gender affirming care. So AAP, which is like the overriding group for pediatrics, they have all the recommendations for what antibiotics to give for a pneumonia. They give all the recommendations. And their recommendation is to provide this care for youth because, again, we know the benefits. And so at most children's facilities, you'll find gender affirming care in varying levels, like how big of the program is.
Got it. Because I can't help but notice. So Virginia is sandwiched between, West Virginia, North Carolina, and I'm wondering if those states have kind of the same resources that we have in Virginia, or do you see a lot of patients from these sort of borderline states?
There is a lot of variety in terms of state to state, and again, it's because unfortunately this care is very politicized. Just like in the state of Texas, they had to close a clinic because the state, there are now protocols in place to decrease access to care. So yes, it does vary state to state, and there are situations where people have to cross state lines.
Interesting. Well, thank you so much, Dr. An Pham.
Yes.
She is a gender affirming care doctor at the Children's Hospital of Richmond at VCU. And like I said, I highly endorse that hospital. And now I highly endorse Dr. Pham. So thank you for stopping by and answering our questions for us.
Thank you so much for listening and giving space to even talk about this topic. So thank you so much.
Awesome. Thanks. And we will see you all next week.